Are you taking an antibiotic and wonder if it could be causing diarrhea? I'm Dr. K from iMedicalSchool. If you want to know how antibiotics can affect your gut and 3 things you can do about it, stick around. If you learned something, please like, share, and subscribe. 2 months ago, I was feeling horrible with a pounding sinus infection that had lasted for 2 weeks. I hate taking medications, but I had to get some relief. So I set up a telehealth visit and with the help of my doctor, got a prescription for Augmentin. After I started taking it, my sinus infection started clearing up. But the antibiotic did have some unintended consequences.
What are you doing? It's coming out of me like lava!
So how do antibiotics cause diarrhea? Antibiotics are used to treat bacterial infections. But what we have to remember, they are not specific for bad bacteria alone. Bacteria normally lives in our intestinal tract. The balanced population of good and bad bacteria in our GI tract is called the gut biome or flora. When we take antibiotics, we can change the gut flora. In fact, use of antibiotics in childhood increases the risk of Crohn's disease, which is an autoimmune disease of the bowel. In addition, antibiotics can wipe out the gut flora, leading to bad bacteria to flourish. One example is a bacteria called Clostridium difficile, otherwise known as C. diff. C. diff is a bacteria that tends to cause severe diarrhea, typically after taking antibiotics. C. diff is a very resilient bacteria that forms spores or an outer protective covering that allows it to survive on surfaces for long periods of time. In addition, many cleaners will not kill it, and in fact, bleach is the only product that can really effectively kill it. If you are experiencing diarrhea when taking antibiotics, it is important to check with your doctor if you have a C. diff infection. So what are the 3 things you can do about antibiotic-associated diarrhea? Number 1, the most important point is do not take an antibiotic unless you have to. Many infections are viral and not bacterial. So antibiotics will not help.
What you talking about, Willis?
Many times, the body needs time to fight off the infection and for the body to heal the inflammation. Number 2, consider taking a probiotic. A probiotic is a collection of good bacteria that can help restore the gut biome. Now, there's some data that supports some strains like S. boulardii, L. acidophilus, and B. bifium can actually reduce the risk of C. diff infection. I tell people, probiotics are not magic, and like any supplement, should be treated as a medication. There are certain people who have a poor functioning immune system due to chemotherapy or other causes that should not take a probiotic. It's important to check with your doctor first. Also, if you do take a probiotic and it does not help, then stop taking it. No need to waste money on something that is not working. But this brings me to my next point. Number 3, eat healthy. What we eat plays a large role in how our gut feels. Processed foods tend to contain a lot of sugar or false sugars. When we are not feeling well, eating processed foods can be comforting, but we should be careful as they can lead to bloating and even loose bowel movements. In addition, dairy foods can cause more bloating, and actually, we can become temporarily lactose intolerant during stressful times. When taking an antibiotic, try to avoid dairy products. The only exception is yogurt. Yogurt is a source of good bacteria. This does not include yogurt that is high in sugar, so check the label. You can even make yogurt at home. What if you do all this and it still does not help? Well, that brings me to the 4th point. Number 4, ask your doctor about an antidiarrheal. If your diarrhea does not get better, ask your doctor if you can take Imodium to slow things down. You may need to complete testing to make sure no C. diff infection is present, but if you're able to take an anti-diarrhea medication, hopefully with finishing the antibiotic, you should get relief. If you have any questions about this topic or any other topic, place them down below and I may just do a video about your question. If you learned something, please like, share, and subscribe. I'm Dr. K with iMedicalSchool, and remember to keep learning.